Moving down the alphabet, C is for cancer. Well, obviously, a huge topic in people and animals alike, but few rules to follow. Cancer cannot be screened for very effectively unless one pays attention to little lumps and bumps. Those ones tend to be the easiest to diagnose and screen for. I get oftentimes a question, well, if you're doing a blood test, can you just confirm or rule out cancer? As you know from a human medicine, it's not that simple. There were some tests that were on the market that I did try years ago, but these healthy dogs that are still alive today were testing positive. So I did not really follow through with that particular company for that particular blood test. I am not saying that it's not coming, but to the best of my knowledge, no, there is not definitive take a little bit of blood and diagnose cancer or rule it out. That being said, there are exceptions to the rules. One is obviously monitoring the lumps, where we typically, as a first step, put a needle into it, put it under the microscope, and look for cells that either look healthy or there's some features that are concerning. I'm a general practitioner, not a pathologist, so the questionable ones we either send out, but if it doesn't look right, this little needle test goes a long way, and I highly recommend it. I use it all the time. And if it does not look completely benign, meaning non-cancerous, we typically remove it surgically with good margins and send it out to the pathologist to tell us what it was and did we get it all. Again, word of caution a little bit. I can remove larger masses from, say, the trunk of the animal, but if you have some growth that is on, say, the toe of the animal or elbow area, think about how much skin we have to close it back up. So if you notice a faster growing lump on the animal and it's not in the area where the skin is loose, get it checked rather sooner than later to avoid potentially, in extreme cases, amputation, because I can remove the lump, but can I close up the skin? And if the answer is no, then you are risking a lot more radical solution to the problem. So the older animals should be screened twice a year. Oddly enough, when I say older animals, generally any animal past 7 years of age ideally should be seen twice a year. And oftentimes people correlate cancer treatment with chemotherapy or radiation only. There are some other possible helpful alternatives that we use in veterinary medicine that could be helpful in certain cases. And it's along the lines of supplementing with proper nutrition, vitamins, some mushrooms with anti-cancerous properties. Obviously the effectiveness is limited if this is an advanced stage of cancer that is everywhere. It may buy us a little bit of time. Any treatment, we just do our best. But do not give up hope. There are things out there that are helpful. Again, early detection is a key. I do recommend twice a year blood work for any pet over 7 years of age to catch conditions, not necessarily cancers, earlier. So it is easier to treat elevation on a blood test for the liver or kidneys, especially in cats. When it's beginning than if the animal is actually sick from it. So this note is aside from the cancer, but on a preventative basis, if we wanted to do what we can, it would mean screening twice a year, which typically does not include MRI and CT scans twice a year, but general exam and the baseline blood work can go a long way. Also monitoring all the lumps. As far as the internal organs go, the common type of cancers of, say, spleen and sometimes base of the heart, those tend to be obviously a lot more difficult to screen for until later stage. So nothing is perfect. We just do the best we can to influence the conditions that we can.